4.7% of the population in Canada will undergo an episode of major depression in any given year. And the problem is that more than a third of them don't get better on conventional treatments. So it's a tremendous number, and what's sometimes obscured is the human cost of that. I copied that circle there off of a questionnaire that was done by a patient in my clinic. There are not many disorders in medicine where a person actually says, I'd rather be dead than have this. I sometimes draw an analogy to the fracture clinic, which is downstairs at our hospital, which sees hundreds of people. And an individual fracture specialist can see lots of people down there. We don't have a fracture crisis where if a person breaks their leg on a ski slope, we have a fracture crisis in Canada where only 1 in 5 people with broken legs is able to actually get in and get treated. And this is what we practice in our clinic, repetitive transcranial magnetic stimulation. That butterfly-shaped coil you see there is about the size of 2 sliced bagels stuck together. It's an electromagnet, so there's wiring inside. It can deliver finely focused magnetic field pulses to anywhere in the brain to a depth of about 2 or 3 centimeters. In the background, you'll see an MRI up on that computer screen. We can use an MRI to guide it, and by applying repeated pulses over time, you can strengthen or weaken circuits in the brain that are overactive or underactive. And this is what it looks like if you were to undergo rTMS. You're sitting in a little chair there. It's like a little dentist chair. There's an MRI in one corner there you can see. There's a little camera in the middle that's tracking the person's head and the stimulator. So we can position these to an accuracy of within 2 millimeters, anywhere in the brain that we want to stimulate. And that allows us to target circuits in a much more finely focused way than therapy or medications for people where therapy and medications aren't doing the job. If you give people 20 or 30 sessions of stimulation, you can actually get more than 50% of them to the point where you've knocked their symptoms down by half. There are a lot of new treatments in the pipeline, not just rTMS. There's a non-invasive version, a milder electrical version that you may be able to take home with you. It's about the size of a pager. That's under development. I'm looking at that coming in the next 3 to 5 years. There are a couple of new medications that look like when they work, about half the time, they clear up depression in 24 hours. Those are currently being under study. There are new options that work by completely different mechanisms than everything we've had for the last 60 years.
We didn't use the C word. We didn't talk about a cure. So people have to come back and get booster shots, if you will. Is that right?
Yeah, so as I said, depression's like a traffic jam pattern in the brain. It's not a chemical imbalance. It's a brain arrhythmia, if you want to think of an abnormal rhythm in the brain. Some of you will know someone who has an abnormal rhythm in their heart, extra beats or skip beats, and that's a recurring condition. If you take medication for it, and you come off the medication, the abnormal rhythm will creep back in there, and the brain is the same way. So in terms of, we have treatments that will put things right, but unless you want to physically go in and structurally alter the entire brain, then doing these treatments is going to be a treatment for it rather than an outright cure where you just take the condition away. Right?
And we know the brain is sophisticated. We can develop, people can be resistant to treatments, to drug treatments after a while. Is there resistance to develop to this? Does the depression say, I know what you're up to, I'm gonna take a different route?
That's actually the good bit. So if it works, it seems to keep working. rTMS does not last forever. It's more like exercise than like surgery. So you'll do a course of it, and then usually somewhere between, the average is about 10 months. The person may say, it's coming back again, I need to come back in. So we'll do a booster treatment in that case. The booster treatments seem to get further and further apart over time, but it does work over and over again.